Hi guys, this is Jamaline Magiliman Masalagat, your student nurse from University of Mindanao. For this video, I will be demonstrating to you how to administer intramuscular injection. Intramuscular injection route deposits medication into deep muscle tissue which has a rich blood supply, allowing medication to absorb faster than by subcutaneous route. The purpose of intramuscular injection is to first, the less painful administration of irritation drugs, allow more rapid absorption of the drug compared to subcutaneous route. It also administers large doses of medication, and it is to give drugs to clients who cannot take medications orally and for the drugs that are degraded by the digestive juices. The materials needed for these procedures are sterile water. This will serve as our medication vial, medication ticket, sterile needle, it is for aspiration, sterile syringes, working gloves, bandage, cotton balls that is soaked with alcohol, 70% alcohol, recycle bin, and sharp container that contains the used needles. It is to avoid needle stick injury. Now let us move to step-by-step process of the procedure. So prior to the procedure, we have to check the accuracy and completeness of each medication administration record or MAR with physician's order, compare it, and check the client's name, medication name, and dosage, routes of administration, and time of administration. The rationale for that is the physician's order is the most reliable source and legal record of client's medication, and it also ensures that client receives the correct medication. Next with that, assess the client's medical and medication history, including the history of allergies, the type of allergies that the patient has, and the normal allergic reaction.
Assessing the client's medical and medication history helps to determine need for medication or possible contraindications for medication administration. And in case that there's a client allergy, we can inform the healthcare provider to remake the order and hold the previous drug ordered. This will allow us to administer medication safely and monitor client's response to therapy.
Review medication reference information for medication action, purposes, normal dose, side effects, time of peak onset, and nursing implications. Observe client's verbal and non-verbal responses toward injection. Also assess for any contraindication to intramuscular injections such as muscle atrophy, reduced blood flow, or circulatory shock, because atrophied muscle absorbs medication poorly and factors interfering with blood flow to muscles impair the drug absorption.
Anticipating client's anxiety allows you to use distraction to reduce pain awareness.
Assess client symptoms before initiating medication therapy and also the client's knowledge regarding on the medication to be given. This provides information for the nurse to evaluate the side effects of the medication and to possess implications for the client's education.
Expected outcomes following completion of procedure. Client experiences no pain or mild burning at injection site. That medications may cause minor tissue irritation. Second, client achieves desired effects of medication with no signs of allergies or undesired effects. That medication administered without client injury. And client explains purpose, dosage, and effects of medication that demonstrates learning.
Let me demonstrate first how to administer medication such as vitamin K and Hep B vaccine for infants, and the site is vastus lateralis. So, since our patient is infant, all the assessments that would be done would be conducted through interviewing the caregiver or the mother of the infant, and also we have to observe first and we have to observe also the infant.
Get the medicine ticket and compare it with the doctor's order. It is to ensure that the client receives the right medication at the right time. Wash hands. It is to deter the spread of microorganisms. Assemble the syringes that will be going to use.
Withdraw the drug from the vial into the syringe using aspirating needle and replace the aspirating needle with injecting needle after. So I am using this 1 cc syringe. We have to open it here like that, and we have to remove the needle because we are using aspirating needle to aspirate the drug. So there, and then make sure to not contaminate the needle. That's why it's still here. Then let's open it like that, and I'm gonna connect it here. There. Now I am going to aspirate the drug. We have to move it like this, upside down, and I am going to insert, or then I'm going to put an air. The air must be equal to the liquid that we are going to withdraw here. So I am using this syringe and I will going to insert the 0.1 ml of air because I am going to withdraw 0.1 ml of the drug. I'm gonna let the air in like that before I withdraw. There. And after that, I will cup the needle again using fish hook technique to prevent the needle stick injury, like this. After that, I will remove this aspirating needle. And I'm gonna put it here. This container to avoid needle stick injury. And I will replace that into injecting needle.
Prolonged exposure to the air or in contact with moist surface will contaminate the needle.
This one. So now we have the medication. Next with that, identify the client carefully using the name, date of birth, and the hospital number using the by looking at the ID band of the client and compare it with the MAR or medication administration record.
Do not forget to apply 10 rights of medication administration. Provide privacy by closing the curtain because every client has the right to be protected from being exposed to others.
Now we have to discuss the purpose of the medication to the mother and the action of the medication and what are the possible side effects of the medication because they have the right to know the medication and how does medication affects the infants and why we have to do or we have to administer such medications to the infant. Okay, mother, maghatag ka og vitamin K kay baby og Hepa B vaccine ha. Kaning vitamin K, ma'am, protection ni siya against bleeding, ma'am, ha. Importante ni siya para di magka-bleeding si baby. Ang possible side effects ani, ma'am, kay pwede magkalintura si baby after ug magka-bruising pud siya sa site sa injection. Pero ayaw kabala ka, ma'am, mawala ra na siya. Maghatag lang ni og reseta para makapalit ka og tambal anytime magka-fever si baby. And pwede pud nimo butangan og cold packs ang mga site or ang site kay duha man atohang i-inject ang left ug right vastus lateralis man ni baby ma'am. So if magka-swell or magka-bruising ana, pwede ka magbutang og cold packs sa kato na site. Ang Hepa B pod ma'am kay kailangan ni siya ni baby para ma-prevent nato si baby nga maka-acquire og Hepa B. So mag-protection pud ni siya kay baby para sa mga infection sa liver ma'am. Pareha ra na siya side effects ma'am, pwede magka-fever si baby ug magka-swell sa site sa injection. Pero kato ma'am, pwede ka magbutang og cold packs para dili pud kay mag-swell ang injection site. Unya kung grabe na jud ang fever ni baby, pwede nimo siya paimnon og tambal. Maghatag lang mig reseta after ma'am.
Perform hand hygiene and apply clean gloves. This will reduces the transmission of microorganisms.
Next, select the appropriate site. Selecting a site where skin appears to be healthy and free of irritation and inflammation to reduce the discomfort of injection. So since we are going to inject in vastus lateralis of the infant, we have to divide the site into 3 parts or thirds horizontally and vertically and administer the injection in the outer middle third. So like this, we have to divide it and the injection site would be here. Help the client to place on a comfortable position. Relocate the site using anatomic landmarks. Clean the site with cotton balls with alcohol in a circular direction for about 5 cm. Like this. Hold the cotton balls between 3rd and 4th finger, like this. Uncup the needle. And hold the syringe between thumb and forefinger of dominant hand and hold as dart with palm down, like this. Now, I am going to insert 0.1 ml of vitamin K to the left vastus lateralis of the infant.
Position ulnar site of non-dominant hand just below the site and pull skin laterally approximately 2.5 to 3.5 cm and hold the position until medication is injected. With dominant hand, inject needle quickly at 90-degree angle into muscle. Injection into correct anatomic site prevents injury to nerves, bone, and blood vessel. Apply gentle pressure to the site. Do not massage the site since it damages underlying tissues. It ensures that the medication reaches the muscle mass. Apply bandage on the site.
Using the same preparation, I am also administering Hepa B vaccine 0.5 ml to the right vastus lateralis of the infant. I'm gonna reposition now the infant. There. after that, help the infant to be in a comfortable position. Turn the medication ticket to the injection tray upside down.
Do aftercare by discarding the used needle into a puncture and leak-proof receptacle. Remove gloves and perform hand hygiene. To reduce the transmission of microorganisms, return the medicine ticket to its box promptly. This will reduce error and losses.
Stay with the client for several minutes and observe for any allergic reactions. Give the client sense of well-being and tell or inform the mother again to the medication or the medicine that we have given. Akato mother, ang atong gihatag na vaccine kay baby kay Hepa B o vitamin K vaccine ma'am ha.
Return to the client's room after 15 to 30 minutes to assess for any discomfort. Inspect the site and note for any bruising or injuration. Bruising or injuration may indicate complication associated with injection. Document the findings and notify the healthcare provider. Observe also for client's response to medication at times that correlate with onset, peak, and duration of medication.
Now let us go to deltoid site. Deltoid site is the most recommended for adult patients. By identifying the client, you have to ask the client's name, date of birth, and the hospital number. And you have to compare the MAR of the patient and the ID band of the patient. And you also have to let the patient state his or her name, including his or her birthday. It is to really ensure that you are going to give the right medication to the right client. Discuss the purpose of medication, the action, the possible side effects, and allow the client to ask any questions, and tell the client that the injection site will cause a slight burning or sting. Because the client has the right to be informed, and client's understanding of the medication improves adherence to drug therapy and helps minimize client's anxiety. Good afternoon, sir. I am Gemaline Magilian Mamasalagat, your student nurse from University of Mindanao. Pwede ba ni may state imuhang name, sir? Ano sa imong birthday, sir? Okay, sir. De La Cruz. Okay, so karon sir, maghatag ko og tetanus toxoid sa imuha, sir, para ma-prevent nato ang tetanus or lockjaw, sir, ha? Kaya kung naamang ko tayo tetanus, sir, pwede ta magka-seizures o lockjaw that could lead to bone fracture, sir. Ang mga side effects ani, sir, kay mild fever, joint pain, mga muscle pain, ana, sir, pero maghatag mi og medication para in case na magka adverse effects, sir, nga grabe na jud ka sakit ang imuhang mga joint, pwede nimo siya mainom, sir. Nakasabot ka, sir? Okay. Since our patient is adult, we have to administer the medication to the deltoid muscle right here. The deltoid muscle site is located by palpating the lower edge of the acromion process. Here, the end of this bone. And you have to measure it like this, and the injection site would be here. Now I am going to administer 0.5 ml of tetanus toxoid to the right deltoid of the client.
Clean the site with cotton ball with alcohol.
Help the client in a comfortable position. So since I am going to administer the medicine into deltoid muscle, we have to let the patient sit.
Uncup the needle. Administer the drug in a 90-degree angle. Apply gentle pressure to the site and do not massage the site as it causes damages to the tissues. Cup the needle using fish hook technique. It is to prevent the needle stick injury. Put bandage on after.
Help the client to a comfortable position.
Remove gloves and do hand hygiene. It is to reduce the transmission of microorganisms.
Stay with the client for several minutes to observe any adverse effects.
After 15 to 30 minutes, ask the client if he or she feels any acute pain, burning, and numbness at injection site. Continued discomfort may indicate injury to underlying bones or nerves. Inspect the site and note for any bruising or induration. Bruising or induration indicates complication associated with injection. Document all the findings and notify the healthcare provider.
Sir, unsa gani ang drug na ato ang gi-administer gaina, sir? Unsa gani purpose ato, sir?
Asking the client to explain the purpose and effects of medication evaluates the client's understanding of
Very good, sir.
information taught. Immediately after administration, record the medication dose, route, site, time, and date given on MAR. Correctly sign the medication administration record according to agency policy. Record the client teaching, validation of understanding, and client's response to medication in nurse's notes. Report any undesirable effects from medication to client's healthcare provider and document adverse effects in record. This will prevent chances of errors in medication.